The contraceptive implant. The implant is a popular method of long-acting reversible contraception, or LARC. It's chosen more and more by women of any age. It's over 99% effective, more effective than condoms, or even the pill. The implant is a small, flexible plastic rod. It's fitted just under the skin on your upper arm. It works by releasing a tiny amount of a hormone called progesterone into the bloodstream. The progesterone stops your body from releasing an egg each month, so preventing pregnancy. The implant is almost invisible under your skin, so nobody else can tell it's been fitted. Why do women choose the contraceptive implant? It doesn't get in the way of sex, unlike condoms. Once fitted, you can forget about contraception for 3 years. Once removed, your fertility will return to whatever is normal for you within days. Before the procedure. The implant can be fitted at any point in your cycle, provided there's no chance you could be pregnant. We ask that you don't have unprotected sex for at least 3 weeks before fitting. This includes sex when your method of contraception has passed its expiry date, or using withdrawal or natural methods of contraception. How is the procedure done? It only takes a few minutes to put the implant in. First, you'll meet the clinician who's fitting your implant. We'll ask you about your medical history, do a pregnancy test if required, an STI test if needed, and answer any questions. We'll numb a small area of your arm with local anaesthetic, which may sting slightly for a few seconds. Then we'll slide the implant under your skin. You might feel some pressure, but no pain. We'll put a dressing on your arm to cover the small cut made by the insertion. Most clinicians also apply a pressure bandage to reduce any bruising. After the procedure. Most women feel well enough to leave the clinic straight away and can travel home by bus, taxi or car. You may like to bring someone with you to take you home. After the local anaesthetic has worn off, you may have some tenderness or swelling around the implant. This can last for a few days, and the area may look bruised for up to a week or 2. If the implant is fitted during the first 5 days of your period, you're protected from pregnancy right away. Otherwise, we advise additional contraception, such as condoms, for 7 days. We'll give you a card with the expiry date written on it. Keep this safe. The device can be removed at any time. We recommend you use an alternative method of contraception before the removal, so there's no gap in your protection against pregnancy. Side effects. Most women have no problems. Around 1 in 10 women notice hormonal side effects in the first few months,